a demonstration of hip movements, active, passive and resisted. We will start with active movements. Active flexion, 0 to 120 degrees. And you bring your right knee up towards your chest. And can you place it down on the mat? Active abduction, 0 to 45 degrees. Linda, can you bring your right leg out towards me? And back in. Active adduction, 0 to 30 degrees. In order to achieve this, you have to move the opposite leg away so it doesn't obstruct the examined leg. Can you move your left leg over the edge of the trolley? Can you bring your right leg over as far as possible towards it? And back. And bring your left leg back. Active medial hip rotation, 0 to 45 degrees. Linda, can you bring your right knee up towards your chest? Can you swing your lower leg out towards me? Then back to the midline and down. Active lateral hip rotation, 0 to 45 degrees. Linda, can you bring your right knee up towards your chest and swing your lower leg towards the midline? Then back and down. Active extension, 0 to 30 degrees. Linda, can you lie over onto your stomach? Can you lift your leg up off the mattress and down? And can you lie over onto your back? This completes active hip movements. Passive movements, passive flexion. In order to achieve this, you should lift the trolley to an appropriate height to protect your own back. Although the focus is the patient's hip, you should take care to protect the patient's knee and their ankle, as well as your own back. Passive hip flexion. Now push onwards till the hip joint is tight. And down. Passive abduction. Passive adduction. Again, we move the opposite leg away to avoid obstruction. Linda, can you lift your left leg over the edge of the mattress? And can you bring your left leg back? Passive, medial and lateral rotation. Remember to support the patient's thigh and try not to stretch the patient's knee collateral ligaments. Medial rotation. Lateral rotation. Passive hip extension. Linda, can you roll over onto your stomach? I will examine Linda's left leg for this. And can you roll over onto your back? Resistive movements. We'll begin first with 3 movements. Linda, can I ask you to sit over the edge of the trolley? Resisted hip flexion. Linda, can you bring your left knee, up towards your chest? Now begin gently and slowly increase pressure to a maximum the patient can tolerate before easing off. But you shouldn't move the patient's joint because this invalidates the test. And relax. Resisted hip medial rotation. Linda, don't let me push your leg inwards. And relax. Resisted hip lateral rotation. Linda, don't let me push your leg outwards. And relax. Resisted abduction and resisted adduction. Linda, can I ask you to lie over onto your left hand side? And can you bring your right leg up off the mattress? And don't let me push your right leg towards your left leg. And relax. Support the leg in between. And Linda, don't let me pull your right leg towards the ceiling. And relax. And can you come back over onto your back? Resistive hip extension. Linda, can I ask you to roll over onto your stomach, please? For this examination, I will examine Linda's left leg. Linda, can you lift your left leg up off the mattress? And don't let me push it down towards the mattress. And relax. Can you roll over onto your back?